Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
Access to the Cancer Institute is one challenge that hinders treatment cycles for cancer patients, and with the outbreak of COVID-19, the Executive Director of the Institute, Dr. Jackson Orem, says this was escalated.
The numbers of people coming to get care was particularly low in the months of March, April, and I think to some extent also May last year. But for those who were able to come and those who were able to interact with and we were able to follow up later.
A disrupted schedule could be detrimental for the cancer patient, according to Dr. Orem.
When you disrupt those schedules, you are not sure whether actually because of that time difference the patients are getting or the disease is being hit at the right time.
The barriers to cancer care are majorly socio-economic. Many patients face financial ruin when they try to pay for the treatment, even with a subsidized government service. In Uganda, chemotherapy can be accessed in some districts other than Kampala, including Mbarara and Arua, but radiotherapy requires one to come to the institute.
You can imagine somebody far up country who is diagnosed with cancer and told that they've got to come to the Uganda Cancer Institute for treatment. The problems of transport, of food, accommodation, the whole social structure of the problem is really huge. Many of our patients are actually very poor. They come from very poor families, As when they get to hospital, they've got to do a number of investigations, and that creates a lot of barriers to access to care.
Dr. Orem says they are working out a plan to establish other cancer centers.
As I speak now, we have the funding now for establishing at least one, which is the one in Gulu. So we need to look for the resources for the 3 more. And when we are talking about resources, we are talking about billions of shillings. We are not looking for the establishment at the word go of a physical infrastructure. We can start with functional cancer center. And when we're talking about the functional cancer center, the functionality, that means can somebody walk in and get care? In Barara, for instance, we already have a functional regional cancer center there. We do not have a physical one, but within the premises of the regional referral hospital, working together with the university, that is Barara University of Science and Technology, we already have a service there. And we have our doctors actually stationed there and they're seeing patients. And the same in Arua. Last week, actually, we launched the one of Arua. We have already a facility within the regional referral hospital. The next, we are going to go to Gulu, and then we are also going to go to Mbali.
Despite the challenges, Uganda Cancer Institute has advanced into a regional center of excellence, but this also comes with a lot of demands, including being able to train specialists in various fields of cancer care. Ministry of Health has partnered with several organizations to be able to meet some of its goals. The Mark Foundation, being one of them, is currently training some cancer specialists for Uganda.
Like orthopedic oncology. It was not. This is the first orthopedic oncologist we trained in Uganda. Another gynecology oncology, and other one surgical oncology. We had enrolled 31 doctors in these different specialties. So plus the 3 we trained in oncology in a very unique specialty in oncology. Like I mentioned before, we have 31 in total doctors that have been enrolled in all these programs, and very, very valuable diploma and master degree. I expect also to select them from different provinces, not all from the capital, so they can have a geographic nationwide coverage and improvement of access care in general.
According to Dr. Rasha Keleji, their goal is to have equitable distribution of health workers that can provide cancer care across the country.
The countries where we have partnership with the First Lady to partner with us to select the right candidates, that they will come back to their countries after training and they start to care and give the care and the equitable care in the public sector for all the patients and their communities.
Cancer remains one of the leading killer non-communicable diseases in the country, with 32,000 new cases and 21,000 deaths occurring in 2018. By the same year, 56,238 people were living with the disease. The commonest cancers here are breast cancer, cervical cancer, colorectal, Kaposi sarcoma, which is highly associated with HIV, and leukemia, among others. Health experts say living a healthy lifestyle is vital in reducing the risk of suffering from cancer. Walter Mwesije, NTV.
National Medical Stores, NMS, passionate about your life, with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities in Uganda.